So today's topic is not an enjoyable one to talk about, but it can save your life. We're talking oral cancer. You don't want to miss this one. Hello again, everyone, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the U.S. Before we go any further, I want to get a few disclaimers out of the way regarding today's topic. First, if it turns out that you appear to have, or even know you have, any of these warning signs and symptoms that we'll be discussing, do not automatically conclude that you have oral cancer. And second, if you are concerned, then please make an appointment with your dentist or physician for an examination, and together you can decide on the appropriate course of action for you specifically. Please understand that I'm obviously not diagnosing anyone, but simply relaying vital information. It is not my intention to scare anyone either, but simply to educate you on things to look out for, okay? This is very important for you to understand. Okay, let's begin. So to start out with, who gets oral cancer? Well, according to the American Cancer Society, men are twice as likely to develop oral cancer than women, and men who are over 45 face the greatest risk. However, an increasing number of adults under 40 are being diagnosed. It's estimated that over 53,000 people were diagnosed with oral cancer in 2020. Early detection is key. If these lesions are treated early enough, the survival rate is quite high. So what are some of the risk factors for the development of oral cancers? These include smoking. This is a big one. Smokers are 6 times more likely than non-smokers to develop oral cancers. This includes the usual suspects such as cigarettes, cigars, and pipes, but also includes vaping. Now, vaping was always marketed as the safe alternative to smoking, and that is simply not true. There are just as many toxins in a vaping pen than a cigarette, so please don't be swayed by the hype. Smokeless tobacco users. Users of chewing tobacco or dip or snuff are 50 times more likely to develop oral cancers in their cheeks, gums, and on the inside of their lips. Excessive alcohol consumption. Drinkers are 6 times more likely than non-drinkers to develop oral cancers. If you have a family history of cancer, you are at greater risk yourself. This is another big one, excessive sun exposure, especially at a young age. You gotta wear your sunscreen and lip balms with a strong SPF, and don't overlook tanning beds for those of you who are into having a year-round tan. And last, if you had a previous human papillomavirus infection, HPV, you are at greater risk. Okay, so what should you be looking for inside your mouth as potential signs and symptoms of oral cancer? Be aware of any swellings, any lumps or bumps, areas of rough spots or crusty spots, or any areas on the lips or in your mouth where the skin is eroding away. The healthy color of the skin in your mouth is pink, so be on the lookout for any white patches or dark red and even purple areas or spots. Take note of any unexplained bleeding in the mouth. Any unexplained numbness, loss of feeling, or areas of tenderness should be noted. Persistent sores either on your face, neck, or mouth that bleed easily and are not healing, especially after a couple of weeks, are not to be ignored. A sensation that you have something stuck in the back of your throat is noteworthy. Any difficulty with chewing, swallowing, speaking, or moving your tongue or jaw. Teeth that suddenly become loose. Dentures that stop fitting. You may notice your voice is always hoarse, or the sound of your voice changes pitch. A chronic sore throat that never seems to go away should be observed. Pain in your ear that remains. You may notice your teeth don't come together the way they used to when you bite down. And you may have dramatic, unexplained weight loss. You know, folks, your dentist and hygienist are 2 of the best healthcare professionals to detect oral cancers. We're on the front lines every day, looking into the oral cavity. We're gonna notice anything out of the ordinary, so be faithful with your dental appointments. The vast majority of dental offices have oral cancer screenings as part of their normal routine for new patients and for regular patients coming in for their teeth cleanings and checkups. It's okay to ask your dentist if an oral cancer screening was performed if you weren't sure. This is a partnership, but you can help by taking an active role in detecting oral cancers yourself by conducting a self-exam at least once a month. Get a bright light and a mirror and take a look around. Feel your lips and gums for bumps. Pull your cheeks out and look for any discolorations. Tilt your head back and look at the roof of your mouth. Pull your tongue out and look along the top, the sides, and don't forget the underneath. Look at the floor of your mouth. Look at the back of your throat. Feel along the sides of your neck and under your jaw for any lumps or bumps. Report any concerns you have to your dentist. If it turns out to be a false alarm, who cares? But if it turns out to be something serious, wouldn't you be grateful that you took the time to look? I know all of this information can be a bit overwhelming, folks, so I have created a free PDF document which I will link in the description below, summarizing the main points of this video, namely where to look and what to look for in screening for oral cancers. I hope you find this helpful. Again, not the most uplifting video, I realize, but an extremely important one. I truly hope you learned something that you didn't know before. If you liked this video, would you do me the favor of hitting that like button, as it will help this channel grow? Please consider subscribing and be sure to hit that bell icon so you can be notified of future educational videos on dentistry made simple. Bye-bye.